And if you can't absorb it through the gut, get it another way. Hi, this is Dr. Tanya Kormeili. I'm a board-certified dermatologist in Santa Monica. Today I want to talk to you about perimenopause and menopause, an inevitable event in our lives as women should be we lucky enough to age and live a life. This is a time of enormous change, and what I see, not just in my own life now being perimenopausal, but also women that I've had the pleasure of taking care of, our hormones start changing, our body goes through a change. We go from becoming reproductive beings to becoming non-reproductive beings, and what that means for us, in our role in society, for our families, at work, for us internally, and how we relate to ourselves. Because menopause is defined as not having a period for 12 months, and our periods are a result of ovarian function, menstrual cycles ending kind of demonstrate that we have ovarian failure. There's very little that the ovaries are putting out. But this cycle really starts 5 to 10 years prior to us losing our periods and going into menopause, as the estrogen levels and the progesterone levels start declining. But also our male hormones start declining. So it's not unusual for a woman to also be low in DHEA and in testosterone. So let's review what these hormones are and what they're doing and how they affect our body. Because if we really understand what's going on, then we can really make big changes to correct what's happening and to really stay on top of it. Because if we live to be 100, that's 50 years potentially that we're living into menopause. So the first hormone we're going to talk about is estrogen. Estrogen impacts our collagen development, our bone development, a lot of activity in our brain, heart, bone function. When we go lower in estrogen, we can get like brain fog, heart disease, osteoporosis. Not being able to make collagen shows up in the skin as wrinkles and hair loss. It really affects your whole overall tone of the body. Progesterone plays a huge role in our mood. It really helps with our sleep and fluid retention. Lower in progesterone, you might feel that you have difficulty falling asleep, difficulty staying asleep. Your sleep quality may not be as good. You may feel all sorts of mood changes. It's really important to be aware of these mood changes, because when women go through menopause and they're having these mood changes, and they may have more anxiety, more depression, less energy, fatigue, and these hormonal loss symptoms mimic clinical depression, clinical anxiety. In my opinion, there's a lot of antidepressants and mood stabilizer given to women when they really need hormones, not just bring back our mood, but to really affect the overall decline of body health that's going on. So when you're getting these symptoms, always check with yourself, are my hormone levels falling? Am I really needing that little bit of extra support before you reach out for something to numb those symptoms, like psychiatric medication? Other hormones that fall are our androgens, right? Testosterone and DHEA. Loss of libido, lower our muscle mass, because testosterone is an androgen that helps build mass. So if you look at men, they stay muscular and leaner longer because they have a testosterone function for much longer. Testosterone also gives you energy, gives you that sense of vitality for life. So if those male hormones are going down, you may feel more fatigue, you may feel not as sexual as a being. What can we do about this? Well, I think during this time it's really important to get your blood drawn and to be able to see the hormones that are declining and speak with your doctor, see what hormones you can replace. That is really important. You don't have to take an enormous amount of testosterone like a bodybuilder. You may need very little for you to get that libido and energy back and to support your muscles growing. Muscle and bone health are very important, and there are things you can do to encourage their growth. Being able to do stretching, lifting exercises with weight, are devices like M-Sculpt, where you can get strong contractions to certain muscle groups, right? Abdomen, glutes, thighs, biceps, triceps, calves, where you can really give a whole lot of energy into that muscle and help the muscle have not just hyperplasia, which means increased number of muscle fibers, but also hypertrophy, so each muscle fiber is thicker. There are so many devices that as dermatologists we have, and that's why we become sort of menopause experts, to be able to build collagen, right? To be able to get wrinkles out of the way, to be able to improve tone, elasticity, discoloration that may be happening. So there's a lot we can do overall. Good diet, take in the nutrients, not just into your mouth, but into your bloodstream is very important. As we age, our gut also ages. So you might have decreased motility, right? Constipation is very common in the elderly. Increased absorption, so you're eating the food, but the nutrients are not going in. Your gut may get inflamed, it may get leaky. If you're having a vitamin supplement, it it may not even be absorbed the same way that it was when you were 20. Stay on top of that and make sure you're not developing anemia, because without blood, you won't be able to perfuse your other vital organs, the B vitamins and the antioxidants and the minerals necessary to repair your body and to regenerate more of yourself. One of the things we offer in our practice, injections of vitamins, because when you inject into the muscle or when you get it through the vein, it goes immediately into your cells. We're not metabolizing alcohol the same way. Alcohol is a very pro-inflammatory agent. So drinking in excess when you're older is very detrimental to your health. It dysregulates your hormones, it dysregulates your sleep, and it causes accelerated aging. Making sure you're properly hydrated, because our cells do tend to dehydrate as we age. Emphasize sleep. Sleep is not a waste of time. Sleep is where your body is regenerating itself. It's like time out, let's make more of me. We also talked about progesterone. Now, progesterone cannot do that in a cream form. You have to take it orally to be able to really get the metabolite of progesterone from the liver to be able to support optimal sleep. But before you turn into sleep aids that make you groggy, put you at chance for falling, cause more mental fog, make sure you're getting your hormones optimized to get that extra boost in brain health to be able to really function better and to get proper nourishing sleep, as opposed to medication-induced sleep, which you're knocked out, but you may not be going into those natural, deep, rejuvenative states. Very important, and research shows that women really need other women. We need connection, we need that oxytocin, sense of camaraderie with other women. So stay connected to your friends, get lots of hugs, give lots of hugs, watch movies that induce laughter and get those endorphins going. Stay away from drama, things that put so much cortisol on your body. Such an important factor to remember in every stage of life, but particularly after menopause, to really optimize your health, allow your body to replenish, use that time for sleep, look at your hormones, look at your vitamins, look at your minerals, and make sure you're optimizing yourself. And do stay connected with the people you love. And if you can't absorb it through the gut, get it another way, because you really need those ingredients and you really need that support for the next 50 years to come.